Dr. Stephen Hussey, thank you so much for being on the Dr. Tyna Show. I am excited to have you here today. I found you through social media, through the Instagram world, and was loving your posts, realized that you were an author of a great book called Understanding the Heart. And then I just found out recently that I maybe was your professor in chiropractic college. So I'm super excited to have you here. This is a great topic and my audience members really love it. They need it. And I'm excited to dive in. So can you introduce yourself to the audience, please?
Yeah, so I'm Dr. Stephen Hussey. I'm a chiropractor and I have a master's in functional medicine as well. I have a very, musculoskeletal type chiropractic practice, but then online I do a lot of health coaching and I like to research and write books and things like that. And so, yeah, like my interest in the heart came from, my own health journey and how I had a lot of inflammatory conditions when I was a kid. I had asthma and IBS and I used to have chronic hives that just broke out all over my body. And doctors really couldn't tell me why. They just gave me steroids and stuff, but ultimately ended up with autoimmune type 1 diabetes from that inflammation. And now my body doesn't make insulin. And, I've corrected most of those ailments, but that type 1 diabetes is kind of the collateral damage that came from that. And so that heavily predisposed me to heart disease. And so throughout my entire adult life, I've really been kind of looking into that disease and health in general. And I found a lot of things that are very contrary to what I was taught and told in school and in other places, what the conventional wisdom about heart disease is. And so I started sharing that a few years ago and then eventually put it down to a book, which is Understanding the Heart. And so here I am and having a good time doing it.
I love it. I am excited to talk to you about this topic and everything you just mentioned too, because my listeners know I have a bit of a similar story. I did not end up with type 1 diabetes, but I ended up with a host of other autoimmune conditions and that persist. And I manage well through, that's really what drove me into naturopathic college. And I'm sure you towards functional medicine was like, it's the personal journey of trying to find answers to help yourself and help your family members and obviously help your patients. But can I ask you about talk about that type 1 diabetes, how that pertains to the masses as a whole, as far as metabolic health goes, and then why does that predispose people to higher rates of heart disease?
Yeah. So with type 1, people hear about diabetes all the time. When we talk about diabetes, there's two main, categories of it, type 1 and type 2, but there's actually other forms of it as well. There's this LADA form that we have. And then there's this, I'm forgetting the term of it. I want to say there's 12 different forms of this other type 2. And some people can cure that just through diet and lifestyle. Not type 2, it's a different form. It's like a type 1 that can cure through diet and lifestyle. So there's those other subcategories too, but the two main ones are type 1 and type 2. Type 1 is kind of this, they used to call it juvenile because it used to happen only in kids. And now it's happening in adults too. But type 1 is where, the main theory is that the body attacks itself in an autoimmune type fashion. So it attacks the cells that make insulin in the pancreas. And so the body no longer makes insulin. And so you're diabetic because you no longer make insulin. Whereas in type 2, you are resistant. You're still making insulin, but your body's become so pathologic, so to speak, that you're not responding to that insulin. You're insulin resistant. So it's kind of like you don't have insulin, just like a type 1, because you're resistant to it, not because you're not making it. Whereas a type 1 is not making it at all. However, the different kind of mechanisms to where we get this blood sugar irregulation, but that predisposes each of those people heavily to the same types of diseases. And they're more prone to things like heart disease, things like, worse outcomes with infection, things like, damage to anything that would damage small blood vessels. So eye problems, kidney problems, that kind of stuff. The thing is, so a type 1, usually can live for a long time if they manage their blood sugars without some of these things, because there's no pathologic state really that's dysregulating or creating insulin resistance firsthand. Whereas in type 2, they're so pathologic that they've gotten to the point where they're insulin resistant. They're already the body's already in a bad state. And so they tend to get these things are predisposed to more readily or more quickly than a type 1 would. But for type 1, why does that predispose someone to heart disease? It's because if we look at the damage that's caused from oscillating blood sugars, so it's not necessarily high blood sugars, even though that's not a good thing to have a high blood sugar. If it's high and stable, that's way less problematic than, say, a blood sugar that's going up and down all day long. So when you talk about that diet of processed carbohydrates that's shooting blood sugar up and making it come back down, shooting up and coming way back down, that's a problematic thing because that's what causes damage to the lining of blood vessels. And so when the lining of blood vessels become damaged, the body's forced to, repair it somehow. And in a state of insulin resistance, which is what type 2 is, insulin is what signals the lining of those arteries to repair themselves. Growth and repair is what is insulin's, main role. And so if you're insulin resistant and you're getting damage to the lining of the arteries, they can't repair themselves. The body's forced to do something else, or else that artery is going to rupture. And so it takes cholesterol and minerals and things like that and kind of uses it like spackle and kind of, patches up the lining of the artery. And that's atherosclerosis. That's hardening of the arteries that we see that is characteristic of cardiovascular disease, or one form of cardiovascular disease. And then people talk about how that, leads to stenosis in coronary arteries. And I would argue against some things about why heart attacks happen and the exact mechanisms of why they happen. But yeah, that's kind of the mainstream narrative. That's why higher blood sugars predispose us to damage the lining of the arteries. The other thing is that if people are familiar with the hemoglobin A1C test, so if what that test is measuring is the percentage of red blood cells in a slide, a microscope slide, that is glycosylated or damaged by glucose. And so if you have higher blood sugars, a higher number of those red blood cells is going to become damaged by glucose. So you get a higher hemoglobin A1C. This just goes to show that higher amounts of glucose causes damage to things. It glycosylates things. It's that Maillard reaction that we kind of talk about. But that's in type 2 and type 1 diabetes, that's more likely to happen. You're more likely to get damage by saturation of glucose to certain tissues, including red blood cells. So that's another reason why we're predisposed to these diseases.
Yeah. And in simplistic terms, I always try to explain it to patients that if you've got a lot of sugar floating around in your bloodstream and it can't get into the cells, your cells think they're starving. And in that process, they drive you to eat more food, which is usually in the form of quick carbohydrates, depending on the cravings and your microbiome and how bad your dietary habits are, and then that excess glucose floating out there, it caramelizes you. I mean, it rusts, it caramelizes. I think of it as when you take the blowtorch and you caramelize the top of the creme brulee, I mean, and that crisping and browning, that's what's happening to the insides of your arteries. That's what's happening to your cell membranes that are supposed to be fluid and, they're a fatty membrane. They're supposed to be nice and fluid. And then most people are eating tons of seed oils, oxidated, rancid seed oils. So their cellular membranes are turning into that. That's what their cellular membranes are being made up of now, is these fatty, gross omega-6s at high doses. And those are already rancid going in. I mean, it's the modern American, especially the standard American diet, we should say, it's been exported across the world is really the perfect storm for destroying people's vascular system. I think people think of heart disease and they think something is wrong with my heart. But what you're explaining here in really good terms is we're talking about the vascular system as well as even being more critical. Can you talk a bit about those distal capillaries, those small blood vessels, and what you were mentioning earlier with some of the organ systems? I don't think people understand that well. They don't understand what destroying your distal capillaries and destroying, whether it's in your musculoskeletal system or in your organ system, what is that doing to people?
Yeah, that's the point in the body where nutrient exchange is happening from your blood to your tissues, right? And so your tissues need these nutrients. And so if we have these damaged delivery mechanisms, these damaged capillaries are the smallest form of an artery. And if they're damaged and they can't get exchange of nutrients very well, or I would say, or the blood or the fluid that is the blood is not moving properly through those, and we're getting stagnant, hypoxic, which is low oxygen blood. Now we're depriving oxygen to tissues, which is a very big deal. Then we're going to get damage, right? And so that's why in diabetes, we start to see damage to areas where there's lots of capillaries, where there's the exchange of these nutrients. So like in the eye, there's lots of little tiny capillaries there, or in the kidneys, or in distal, in the hands and the feet, we start to get that neuropathy type stuff because the tissue or the nutrient exchange in those tissues is not happening because there's damage to these small arteries. And it's if you think about like the size of a capillary is some of them are like, the size of one red blood cell. So there's like one single file red blood cell kind of moving through these capillaries. And that's how, I guess, it's an example of just how slow the nutrient exchange is going to be, like as far as like the oxygen being delivered. And so if it's already that slow because it's that small, and then we're damaging it even more, we're basically shutting off the body's access to nutrients and oxygen. And that causes a lot of issues, especially the longer it goes on.
Right. So the tissues there at the end are getting damaged because they are being deprived of oxygen. So they're dying back, and the nutrients aren't circulating through the body. It's a mess. People don't understand this. This is like the big idea, I think, in all of this. I mean, we can talk about, oh, my uncle had a stent put in his coronary artery, and all of that's concerning. I get that. But it's the slow, low grade damage that people don't realize. And it's not just type 1 and type 2 diabetes, as you well know, but I don't know if the audience knows this. I'm sure the listeners of my show do. It's that low grade metabolic dysfunction that happens for a decade or more before the magic diabetes diagnosis, right? Diabetes
Hmm.
is just a number on a page for type 2 is just a number on a page like, oh, you hit the magic 120 fasting glucose. Welcome to the club. And I'm like, dude, you've been hanging out here for 10, 20 years. And the damage that we are speaking of is happening during that entire process, during those few decades. And it's tough. I remember learning in school that if you see, and maybe this was where we went together in chiropractic college, or maybe it was naturopathic college, I don't remember, but it was basically like, if you're seeing kidney damage from type 2 diabetes, you can bet that that's happening in the retina as well. So these people are going blind. They're going to lose their toes. They're going to lose kidney function. And if anyone doesn't believe us, look at how many dialysis centers are popping up all over in mini malls. That is a horrifying sign of the times that you and I intimately understand, but I don't think most people understand. Why would we need like convenience store access to dialysis centers if our population wasn't severely in trouble?
Yeah, it was the same. Like you mentioned all those things, and in my head, I was thinking erectile dysfunction. If you've got erectile dysfunction, you've got vascular disease. You have insulin resistance, and people don't think about it. They think, oh, I have something wrong with my hormones or something like that. And that could be the case, or it could be psychological, but lots of times it's vascular disease and you have heart disease or cardiovascular disease.
Guys don't want to hear that.
Mhm.
Especially from a female doctor. I would always ask them, actually, one of the clues of low testosterone that I noticed clinically was because I did both. I did a lot of musculoskeletal, as you do, a lot of musculoskeletal medicine, but I ran labs on everybody. And so I was doing a lot of that for a long time. And when I would have someone pull their pants up so I could take a look at their knee to assess them, and I did mostly regenerative injection therapies in the end, last several years, but I would go to assess their knee and their shins would be void of hair, and they would have no hair on their shins. These are men, and they'd have no hair on their shins. And that I started noticing that correlating with low testosterone levels on labs. And so I would immediately ask them like, hey, how do you think your testosterone levels were or are? And that was my nice way of asking about erectile dysfunction. And they got it. And they'd always say, oh, everything's fine down there. And I'd be like, okay, but here are some other common signs: and low stamina, low ability to heal after injury, not getting gains in the gym, not recovering well in the gym, fatigue, brain fog. Because if you've got low T, you've got one foot in the grave, because it's the wicked vicious cycle, right? Like you're more prone to metabolic disease if you are low T, and if you have metabolic disease, you're definitely driving low testosterone. Like that's the cycle. So a lot of dudes don't get this. They just think, oh, I'm getting a belly in middle age, right? Like, what do you tell those guys? Because this is the group that women know. Women are like, I am getting fat and I don't feel good. Something's wrong. But with men are like, oh, no, I'm fine. At old boys club, got the belly. Everything's fine.
Yeah. And well, first thing I asked them was like, what medications are you on? Because if we're talking about heart disease, and the number one drug that's used, I guess attempting to combat heart disease is statin drugs. If you want to talk about depleting hormones, what are your hormones made of? They're made of cholesterol. And if you prevent the body from making cholesterol in the liver, which is what statins do, they inhibit the process of the making of cholesterol from a fatty acid, then you're not going to have enough cholesterol around to be making hormones. And so, that's a huge barrier to a lot of different things, to growth and vitality, but also being a man or woman. Like that's what hormones are, what make women beautiful and make men strong. It's without those things. I mean, it's a travesty that's the main, that cholesterol is so vilified. And that's the main approach to combating heart disease, which cholesterol really has very little to do with, the pathology of heart disease. But yeah, it's just a shame that there's this attack on hormones too, as well as many other side effects of statins.
I mean, I saw 20-something-year-olds on statins. It was wild in clinical practice. And I would explain this to them. And then their wives would be like, you are having some erectile dysfunction. And I'm like, yeah, that's because his testosterone is being poisoned into oblivion. It's a wild, when you understand how the physiology of the body works, and I think you've put it so simply for the audience to understand. Like, I think people start to get it. Okay. So on that note, I want to talk about that a little bit more because it's really important. We see a lot of these shifts in cardiovascular disease start to ramp up in middle age. That is, in my opinion, at kind of that perfect storm of the hormones are starting to decline naturally, which, and you can talk on this more too. The way I've always understood it is we're supposed to have our cholesterol raise as we age, right? Like that's the body's way of naturally compensating for the hormonal decline that occurs with age. And we're supposed to have our blood pressure increase as we age because our pipes are getting floppier. They're not as, they don't have as good of turgor. So when did that shift happen and why, what are the repercussions? Like somewhere in my lifetime, I saw this happen for the most part, like where it really took hold. I know it started before I was born. I was born in early 70s, but like, it's been wild to watch what's like what the allopathic solution is. Let's talk about that some.
Yeah. Well, I mean, so when I think about heart disease, I think I categorize it into like these three main categories of, or three main imbalances that happen that create, I think, all aspects of heart disease, whether it's heart failure, a heart attack, or atherosclerosis. And I think that's poor metabolic health, which we've kind of discussed a little bit. That's inflammation and oxidative stress. And that's imbalance in the autonomic nervous system, which is the system in our body that's, surveying our environment and telling us if we're in a safe or threatening environment. And so when we look at those three things, and then we look at Western medicine's approach to heart disease, they see, this buildup of atherosclerosis, or they see a heart attack that they say is caused by the stenosis in a coronary artery and a blockage, which is sometimes the case, but not always the case. And then they say, oh yeah, and stresses plays a component too. And then they just give you a statin, or they give you a blood pressure medication, which is, to forcefully lower your blood pressure, which is basically a diuretic to drain your fluid so that the pressure comes down. But none of those things are addressing the cause, which is the poor metabolic health, insulin resistance, the inflammation and oxidative stress that could be coming from psychological stress, diet, toxin exposure, all different types of things, and the imbalance in the autonomic nervous system, which I think is the one that's most overlooked is, how stressed are we, past traumas, those kinds of things, are they unresolved, and that kind of stuff. And so there's just a complete lack of understanding of what causes heart disease. And if you can't understand what causes heart disease, then you're going to get the approach to combating it wrong. And that's exactly what's happened in Western medicine. They all they have are these drugs. And yes, they're all, funded by pharmaceutical companies. So they're going to recommend the drugs, that they're all being told that this is the only way. But what that leads to is a lack of understanding, which is why my book is called Understanding the Heart, because I'm trying to understand, or for the most of my adult life, I've been trying to understand what does cause heart disease. And like as an example, and talk about in my book how the heart is not the main mover of the blood like we're told it is. We've totally misunderstood the true function of the heart. And if you misunderstand the function of the heart, how are you ever supposed to treat a dysfunctioning heart, like in heart failure? How are you ever supposed to, accurately and effectively combat that condition if you don't really understand what the heart is and why it's there?
Let's talk about that. So talk about the real function of the heart. Talk about how this all works together.
Yeah. So when you look at the heart and the size of it and how efficient it is, how much energy it uses versus how much force it actually creates, it's pretty much impossible for a heart our size to be pumping blood throughout the entire body. Just there's no way it could happen. And from an engineering perspective. And so there are contraction of muscles and the one-way valves in the veins that, help encourage the flow of things. But for the most part, the blood is moving more or less on its own. The heart does do some pumping, but it's no more than enough pumping to kind of move the blood through the chambers of the heart itself. But the blood is actually moving on its own. And they've actually proven this in animals. They've seen back in the 40s and the 1940s and 1960s, they did the experiments where they'd stop the heart of the animal and the blood would continue to flow up to 2 hours after the heart stopped beating. And so then more recently, they've done this in University of Washington with Dr. Gerald Pollack in his lab and his graduate students. They've shown that when you stop in chick embryos, at least, you stop the heart from beating and the blood continues to flow as long as you put radiant energy into the system. So we're talking about infrared light, we're talking about contact with the earth, other living things, that kind of stuff. And so it turns out that water has the ability to hold energy. And it's a very unique liquid in that it can do this. And when it does hold sufficient radiant energy from the environment, then when it gets next to a hydrophilic surface, which our arteries happen to be, it actually structures itself into what has been termed fourth phase water or exclusion zone water or structured water, whatever you want to call it. And that forms this barrier on the lining of the arteries that actually protects the arteries, but also the way that it forms creates an energy gradient that propels blood flow. Propels flow of water. And since the blood is more or less half water, then that we get flow. And so when you look at it like that, and that the heart is not this pressure propulsion pump that's forcefully sucking in fluid from somewhere and forcefully pushing it out somewhere else, it's actually this contraption that's put in the middle of flow that's already happening. So that's more like a hydraulic ram, which I had no idea what that was when I first heard the term. I had to go look it up and watch YouTube videos that taught me what a hydraulic ram was. But a hydraulic ram is this kind of quote unquote pump that works when water or liquid is flowing into it already. And it only works by that mechanism. And so we have to maintain the flow by exposing our bodies to these things that energize water so that it moves through, or else we're going to get a heart that's working harder than it's supposed to as far as pumping, which is exactly what happens in heart failure. Is we get this heart that starts to expand because it's having to work harder than it's supposed to. And it's because the breakdown of these mechanisms in the periphery, in the arteries, and the veins actually, that aren't moving water. Now, and just if people are like seriously doubting me right now, just think about the lymphatic system doesn't have a pump, but the fluid moves through that. A tree doesn't have a pump, but it gets water from the roots of the trees all the way up to the leaves, doesn't it? And that's because these mechanisms are at play. This happens in nature, not just in animals. And so it's just fascinating to think of it that way. And the thing that solidifies all of it for me is that when you look at the research in people with heart failure and use of infrared sauna, it is just phenomenal. These patients see complete turnarounds in their health and in the function of their heart when we put them in this environment of radiant energy into their body. It's just absolutely fascinating. I don't understand why infrared saunas are not all over the place within cardiology, but I guess we could speculate as to why. But yeah, so completely fascinating that we've totally misunderstood the purpose of the heart. So then people always ask me from that, well, why is the heart there? What is it doing? Like, why do we even need it then if the blood's moving on its own? And it's a good question. And I think it's there for two reasons. One is because another way that Dr. Pollack has found that the water gets energized is when it's vortexed or spiraled in the presence of oxygen. Okay, so there's always oxygen present in the blood. Even in the venous blood, there's oxygen present. And if you look at what happens and you look how the heart muscle is oriented, it's oriented in this spiral-like nature. The heart is actually one big band of muscle that's all wound up on itself. So when it contracts, it does so by twisting like this. And so it is vortexing the blood as it moves through it. Not only that, but when it goes through valves, the blood vortexes and kind of eddies when it goes through valves. And so we are vortexing or spiraling this water in the presence of oxygen, therefore energizing it so that when it gets out into the periphery, it can form this fourth phase water that creates blood flow. So in a way, the heart, I guess, is a little bit responsible for the flow of blood, just not in the way that we thought it was. And then the second reason the heart is there is because there's a lot of research that shows that in athletes, that the heart is actually, like in an athlete, like in endurance athletes, especially, they get that enlarged heart. It's just bigger and stronger, and that's actually, they've shown that it's because it's stopping the flow of blood more effectively, not pumping it harder. It's beefier. It's beefier because it's stopping the flow of blood. Because if I were to go for a run right now and all the blood was rushed over to the arterial side, because it's trying to deliver nutrients to the muscles and everything like that, and the heart wasn't there to slow down the flow, then all the blood would go over to the arterial side and the venous side would collapse, which would result in death. So the heart is there. The second reason it's there is to maintain pressure between the two systems. And that's exactly what we see when we look at endurance athletes. We see that when they are performing at a peak level, that the heart is actually stopping the flow of blood so that it can maintain pressure between the two systems.
That makes complete sense. I mean, it's that hypertrophic cardiomyopathy, but that makes sense. It's got to slow it down and get it. I don't know what the term is in hydraulics, but it's that it's the interchange.
Yeah. No, yeah, I know what you're talking about.
I love this. So my husband's a millwright. Which the audience probably doesn't know what that is. I didn't know what it was either, but he's an electrician too, but he works in mills where they build huge equipment, right? And so he understands all of this stuff. And I have read some of your posts to him, and he helps explain them in terms of machines, which helps me get it better. So that he's been a great resource on that. Because I think you mentioned the hydraulic ram in one of your posts, and I was like, what is this? And he put it into normal people terms, which machinery terms, I guess I would say. And it's all so fast. God, you just blew my mind. I've been so not understanding structured water. I have asked and asked and asked, and I've gotten different explanations, but I know my brain, and I know when I get this tingling feeling when I start to understand something, like I get all tingly and excited. And as you were talking, I was like,
Yeah, and it's
like,
actually
I'm
not
getting it.
like technically, I guess it's not water because it's a different chemical makeup,
Yeah.
or different molecular makeup, I should say, because you're cleaving off one of the hydrogens, and you're left with just an oxygen and hydrogen. Those combine with other oxygens and hydrogens to make the structured water. So the molecular makeup is a little bit different than water, but it's still kind of it's like in this gel state, this fourth phase. It's not solid, liquid, or gas. It's in this gel state. So think of like Jello, and it's what the majority of the water in your body is made up of. So like most of our cells are filled with water, but I don't slosh around like a waterbed. I have some structure to me. And that's because most of the water in my cells should be at least in this fourth phase state, which gives me that, if I take the muscles in my forearm like that, it gives me that kind of bounce back like
A
Jello.
turgor. It gives you like a turgor to your tissues.
Yeah.
This makes sense too, from a chiropractic standpoint, because you know this. I mean, we put our hands on people all day. Not everybody feels the same, right? And you remember day one in chiropractic college that I remember palpating the lateral malleolus, and I'm like, it's not there. I couldn't.
Yeah.
And now, like, I can feel, these are my MRIs, right? Like, I can
Yep.
feel nuances in tissue so subtly. I mean, I can feel energy coming off of them. I can feel tension. I could be a foot off somebody, and I know what's going on. I used to have this thing that I didn't understand before I became a doctor. I used to hug people. And when I hugged them, I knew exactly what was wrong with them. So as a little kid, I would tell somebody like, oh, you should go get your heart checked, or something's wrong with your liver. And my mom did not know what to do with me. And of course, everybody treated me like I was nuts. But I learned later that was my magical superpower in clinic, and I can do it now almost by looking at someone. And I think that's what I'm seeing. I'm seeing that lack of fourth phase water. When they get so sick that they don't make it anymore, their water isn't structuring in their body. And I was talking to you off camera. I watched my type 1 diabetic aunt literally turn into Jabba the Hutt, and she started to melt. And we see this with autoimmune people, right? You can see it walking. I walk through Costco and all I see is melting people. And this isn't a diss on people with excess weight. This isn't a fat shaming thing. Like, I can literally start to see their tissues look like it's melting. And sure, we could approach it from a really logical standpoint and say, oh, that's the increased inflammation is causing collagen breakdown, which it is. All autoimmune diseases at their core are a collagen issue. Truly, I mean, any autoimmune disease you think of is at its core a collagen issue. And I think, severe outcomes with any kind of infection and that cytokine storm is really a collagen issue at its core. And I think they're not making that structured water appropriately.
Yeah. Well, it's interesting you say that, because in my book, I talk about why cancer of the heart is so rare. And one of the reasons is, well, there'll be a long explanation, but one of the things that, Otto Warburg and the metabolic theory of cancer, one of the things he's said over and over again throughout his work was that cancer cells lose their structure. They become amorphous. Instead of these kind of structural round or whatever, evenly spaced things, they lose their structure. And that's because the fourth phase water within the cells is not able to form as well a cancer cell. And so that's not just a cancer cell. It could be all kinds of pathologic type cells, or cells in pathological states, I should say. But definitely he noticed that over and over again. And he commented about it all the time, that's what happens. Cells lose their structure.
Wow. This just explains so many things to me. I'm kind of tripping out.
You should read, there's a book by Dr. Pollack called Cells, Gels, and the Engines of Life. And you would just love it. It blew my mind, and it explains so many things for me that I had observed, but yeah, everybody should go check it out. But it's a really good book.
I think for those of us who have spent, an extensive amount of time putting our hands on our patients, we have a very different idea of what's going on than doctors who don't touch their patients. And most doctors don't touch their patients. And it's getting even scarier now because most of the medical programs have gone virtual for the first several years or first several quarters. And so like students aren't even learning. The naturopathic doctors already came out with horrendous hand skills. And then I was trying to teach them prolotherapy over the years. And it just became so frustrating that by the time I realized the next batch of students out the door were going to have no hand skills, I was like, I quit doing prolo trainings. I was like, I can't do this. I need chiropractors that have license to inject if I'm going to keep my sanity. I love my NDs, but it is a difficult task to teach somebody to stick a needle in a joint when they don't even know how to palpate the joint. Right. So it's not their fault. It's the schooling, and most schooling programs aside from chiropractic and massage school don't teach you to touch your patients. But when you touch your patients and you have the brain power and education that you have through functional medicine and I have through my naturopathic degree, the whole world opens, because you start to link pathologic conditions through the tissues. You start to feel it. I mean, there's a couple examples, which this leads to heart disease. So hang on for my story here. But I remember being in school, and I was in both programs concurrently, and we were learning bone pathology at Western States Chiropractic College, and we were learning lab diagnosis and pathophysiology in differential diagnosis and on both sides, but specifically in naturopathic school. So I was learning how to diagnose things via labs and blood from the inside and the internal workings of these pathologies, but I was seeing them in real time in bone path. And so I don't consider myself a chiropractor who became an ND or an ND who became a chiropractor. Like, I did them both at the same time. So my brain just sort of morphed into something that I don't think there's a lot of on the planet. I have a unique way of approaching things. But when I got into clinical practice, I put my hands on every patient and I ran labs on every patient, as I said, and I started to see things link up. I started to see tension patterns, like in the thoracolumbar junction, that bra line, that classic tension pattern, very often low thyroid function. I started to see that, in chiropractic college, when we had a patient with really stiff, tight calves, what do? We grasp them to death. For the listeners, that's where you scrape them with a tool. It's horrifically painful. That turgor in those calves is myxedema. It's proteinaceous swelling due to low thyroid function. It's a thyroid condition. It's not a muscle that needs working. It's a thyroid that needs some hormone, right? And this all makes sense with this fourth phase water thing, like in my head. And I can't explain it right now because I'm kind of tripping out on it, but I can see how this all goes together. Because when you're low thyroid, though, your risk of, just even being subclinically hypothyroid as a woman, increase your risk of a heart attack like 2.5 times. I'll tell you why. It's because it makes you unable to think clearly, but it also really, it's true. You cannot when you're low thyroid, you've got like 4 of your 8-cylinder engines firing, and you can't make good decisions. I've been there. I've lived with it. I've treated lots of patients. When we get their thyroid turned on, all of a sudden their cognition turns back on. And then we've got everybody on statin drugs, as we mentioned, and those people get a lot of dementia and inability to have sharp cognition. I knew of some pretty high level folks who came in to see me, elderly gentlemen who were about to retire from their awesome jobs because they couldn't think straight anymore. And it was the statin drug, right? And so this all ties back to cardiovascular disease, because low thyroid function definitely makes your lipids go crazy on labs. That's probably, in my opinion, the number one reason why we see high cholesterol and elevated and off kilter lipids more often than not. It has nothing to do, well, I shouldn't say that. I don't want to say it has nothing to do with our diet. It's not because of saturated fat intake if it's from a healthy source. It's from this insulin resistance and this metabolic dysfunction we speak of, but also it's due to low thyroid. But that low thyroid is due to what I just mentioned, the metabolic dysfunction. It's a whole big, they're like eating their thyroid to death. They're like eating themselves into thyroid dysfunction, right?
Yeah. Well, and when you get thyroid dysfunction, like that's the metabolic hormone. Like, so what's the best way to ruin your metabolism? Is you mess with your thyroid hormone, you mess with thyroid function. So yeah.
And then you end up with a heart attack in 10 to 20 or 30 years. So I see these women, they come onto my Instagram and they're asking me for help, and all I have to do is link to their profile and look at them. And I'm like, I know exactly what's wrong. I mean, not in nuanced detail. And I know you see this too on social media. Like the big thing right now is like mold and parasites and toxicity. And I'm not against treating that, but like, let's just talk about hormone balancing. But let's talk about the root cause of all of these. Like parasites don't glom on to a system as readily that is nutrient dense and metabolically sound. Mold doesn't latch on to a body that's warm and moving and it has this structure to its water, and pipes are working, because mold grows in stagnant, like lukewarm areas, not hot, metabolically revved areas. And then all of this leads people down the trail. And in their 50s and 60s, they drop dead of a heart attack. And people say, I didn't know they had any heart conditions. And I'm like, oh,
yeah. Well, it's interesting. What I'm thinking when you're saying that is that there's, like when you talk about mold and parasites and toxins and all that stuff, and all that stuff is important. Like, and I'm going to try and decrease my exposure to all those things as much as I can. However, there's no way you can avoid all that stuff in this day and age. So it's like important to do that, but it's probably even more important to strengthen yourself. Like, let's treat yourself rather than, being obsessed and stressed out about, oh my gosh, is there mold in this room? Is there toxins here? Which are important things to be aware of. It's more important to make sure that your body's resilient enough so that when you are inevitably exposed to those things, because it's going to happen in this modern world, that it can handle it, at least for that time that you were exposed, and you can get through it. I mean, it's the same thing with any infection, whatever it may be, whatever causes infection or the symptoms we know of as infection. Is your body resilient enough to handle that? And instead of focusing on how to strengthen those people, it was this avoidance behavior, this panic avoidance behavior, which is the same thing I see in a lot of people who come to me saying, well, I can't do this because of mold. I can't do this because of this toxin. I can't do this because of this. And it's just like, okay, they're just in this avoidance fear type behavior, which shuts down a lot of things. And so let's empower that person to say, okay, let's make your body resilient so that you can get through those things without having to be in this fear, type state.
Yes, you are singing my song. This is why I came out at the very beginning and I said, okay, guys, let's make ourselves harder to kill. And people got so mad at me and were so just insulted that I would suggest such a thing. And I was like, no, literally, you have the power within a few weeks to shift what's happening inside your body, and you become more resilient and you become harder to kill. It's like this monkeypox thing everyone's worried about. They're like, are you worried about monkeypox, Dr. Tyna? And I'm like, no, I'm not. I had chickenpox 3 times as a kid. That's how sickly I was growing up. I was a very sickly kid. So where I am today is a very much better built machine. I shouldn't say well built. We're doing the best we can, but things are interesting with my immune system. That's how I say it. I think words have a lot of power and diagnoses have a lot of power. So yeah, I've been mold sick severely. I lived in some very moldy places here in Oregon and have been made very ill. I have been bit by a tick and potentially have Lyme disease. I have all these things that people like to use as diagnosis. And I don't ever say I have those things because I don't. I'm just Tyna Moore who's dealt with some shit. And I have a weird immune system that it kind of hyper reacts or underreacts. It's weird. It's autoimmune. It's a funny immune system, but I can keep it. I can navigate it as best I can and have as much faith in it as possible because I put in the work every day to be harder to kill. So you just nailed it. We can't avoid these things, and avoidance behavior gets nobody anywhere. We can't hide from mold. We can't hide from parasites. If you want to live in if people want to like buy a bubble and live in a bubble, then I have a vision of, those bumper bubbles where people go out in the fields and like ram into each other at a big party.
We're all going to be in those.
I mean, that's where humans are so weird. I'm like, just go out and experience life and put in the work daily and I think the root of this comes down to what we keep talking about, which is metabolic health. This is why I do the work I do. And it's why you do the work you do. We're just coming at it from a different niche, if you will, different angle. But at the end of the day, we're speaking the same language. So talk about how you mentioned heart attacks can happen without a blockage or like in a classical heart attack sense. Talk more about that.
Yeah. So I guess the traditional way that people think of a heart attack happens is that we get this atherosclerotic buildup of a coronary artery. So where it's slowly narrowing over time, it's getting stenotic. Okay. And eventually, people will tell you that it gets so narrow that it completely blocks the flow of blood and we get damage to tissue downstream from that artery. However, that doesn't quite make sense to me because there are cases where, someone has like a 90% stenosis in an artery and they go run a marathon and they're just fine. There's no way that person ran a marathon with 10% of the blood that they should have to a region of their heart. There's just no way. And so there's this really interesting, now to be fair, if stenosis is happening and part of that stenosis breaks off because of stress or because it's just unstable, like these unstable plaques they talk about, part of it breaks off and a clot forms and clogs the artery instantly. Yes, that totally does happen. That causes heart attacks. But there are a lot of cases where people get tissue damage in an area of the heart and there's no stenosis whatsoever. There's no blockage, no clot whatsoever. When they go in and they either do autopsy or they go and do the angio, they don't find any sort of thing like that. Yet there's tissue death. And it happens a lot more than we think, because since I started talking about it, tons of people reached out to me and said, hey, that happened to me. That happened to me. And so there was a researcher named Giorgio Beraldi, an Italian guy, and he really looked into this. And what he did, he developed this system called the plastic cast studies. You ever been to like the Body World exhibits where they have like these perfect casts of like the arterial system of a fish or something like that, or an organ in the body? And he developed that technique where he filled the arteries with, on autopsy, he filled the arteries with some neoprene or latex solution, and then he dissolved away the tissue, and he had this perfect cast of the arterial system. And what he found in the thousands of autopsy hearts that he did throughout his career was that anywhere that there was a 70% or more stenosis, the body had built a vast network of collateral arteries that go around that stenosis and fully compensated the heart, the tissue. Okay. And this was everywhere. 100% of the time where there was more than 70% stenosis, the body responded. And, cardiologists, I've heard from cardiologists, yeah, we know about collaterals. They definitely happen, but they can't form fast enough. And I found 2 studies that show that they can form within 4 days. So they gradually produce a stenosis in these rats, and then in dogs, I think too, in the artery, and the collaterals formed within 4 days and totally compensated the area. So this to me explains why when you look at the research on elective stents, so not stents that are placed during a heart attack, those are life-saving, but stents that are placed electively because there happened to be stenosis they found and they want to place one anyways, or bypass surgeries. When you look at the research on those and how effective they are at saving lives or preventing heart attacks in the future, they're abysmal. They're just not very good. It's because the body has already created bypasses. So putting a stent in there or putting another bypass in there is not really going to help the situation, because the real issue is the metabolic health and the things we've been talking about. So what does cause those heart attacks then, where there's no blockage whatsoever? And so I've deemed these metabolic heart attacks, because what happens is we get this forced shift in metabolism in the heart, because the heart prefers fatty acids and ketones for fuel. And research shows that over and over again. The only time a heart tissue prefers glucose for fuel is when it's actually doing reperfusion. So when there has been damage to the heart, when blood comes back into that area, that seems to be when it prefers glucose. Every other time it prefers fatty acids and ketones. And I think there are reasons for that. But there is a situation that can happen where the heart tissue or an area of the heart tissue is forced to burn more glucose than it would like to. And it's the same type of situation that happens sort of in like your muscles, your skeletal muscles. Like when you go for a run, you start to burn more glycogen. There's glycogen stores in the muscles, and you get some lactic acid buildup, some hydrogen ion buildup, and you start to feel burn, a muscle burn, right? Luckily for those muscles, if it gets too bad, you can just stop running and that gets pumped out within the hour. However, if that happens in the heart tissue, that can't happen. The heart has to keep contracting. And so there's a situation where we can get poor metabolic health, where we're already not used to burning fatty acids and ketones, and high oxidative stress that depletes nitric oxide, and an imbalance in our autonomic nervous system, because the stress signal to our heart is supposed to be even. Like if we get a stress signal, there's always supposed to be a lesser non-stress signal, parasympathetic signal that balances it out. However, there's situations like if we get, imbalance in our stress response and decreased vagal tone, then if we get a surge in stressful activity or a big stressful event and a surge in stress response to the heart tissue without that balancing out of the non-stress response, then the surge creates this, all of a sudden, this kind of chaotic state where the heart starts to burn more glucose than it wants to. And if we're metabolically inflexible, then that just happens more readily, right? And the key is the oxidative stress. If we're in high oxidative stress, high toxin exposure, that parasympathetic signal can't get to the heart without nitric oxide. And so nitric oxide is depleted in oxidative stress, and it's depleted when we have damage to the lining of the arteries, because that's where nitric oxide is produced, right? And so if we get these 3 imbalances happen and the stars kind of align, then we get that surge in glucose utilization by the heart, which creates lactic acid, which is angina, if we're thinking about it, right? And then if that happens too much, it actually creates this swelling in the heart tissue. And so that swelling, like usually the pressure is higher coming from the arteries to the heart tissue. But if the swelling happens in the heart tissue, now the pressure is higher going the opposite way, and that tissue is deprived of oxygen. We get this hypoxic, toxic blood system. We get tissue death. And I talk about this whole process in my book with all the research and literature that supports it. But it's a result of these 3 imbalances: poor metabolic health, high oxidative stress and inflammation, and imbalance in the autonomic nervous system. Those are the drivers of heart disease, but especially these metabolic heart attacks, where a heart attack is caused by a shift in metabolism.
This makes so much sense. And I have put pieces of that together, but not like that, not quite like that. That makes so much, my mind is blowing. This is
Or you
so
think about these
good.
things like, because I'm sure
Yes.
as a practitioner, you understood those imbalances.
Yes.
But when you put them together
Yes.
and you see this, observe this thing that happens, and to me, this is why heart attacks are more common in winter, because heart rate variability also goes down in winter, which is the measure of our stress response. It's why heart attacks are more common on Mondays or stressful days of the year. And the research supports this. It's why heart attacks are more common as we age, because we're less likely to have metabolic health as we age. We have to work harder at it. We have more toxin exposure, and heart rate variability goes down as we age, just kind of a natural part of aging. How much it goes down is up to the person, because you can always do things that prevent it from going down more. But that just seems to be what we observe as we age, which is why these things happen more as we age.
Yeah, no, it makes so much sense. I actually struggle with this a little bit personally. Like I get a little bit of angina when my anger goes off. And now, metabolically, I'm beautiful. My labs look great.
Right.
And I've always wondered, what is this? Like, what is, and this makes exceptional sense. We don't have much time because I know that you have to go soon for another interview. Can we talk about heart rate variability a little bit? Before
Definitely.
you go? Because I'll be totally honest here. I wear the stupid Aura ring for that reason alone. And I use the Whoop watch. I was using the Whoop band and the Aura ring together to see which was more accurate. And they were pretty much telling me the same thing. So I realized, okay, like I was looking for accuracy. Is one of these not accurate? And they both were telling me the same thing on the same days.
Yeah.
My heart rate variability is in the 20s and I cannot get it up. And sometimes it'll go up into the 40s, maybe in the 50s. It's random when it does, but I will say it's higher when I am living my life, like when I teach classes to a group of people or I'm doing something I really love. And it also goes up definitely the more steps I get in, the more I go out for walks in that field every day, or the more I get on I love climbing hills and stairs. So anytime I can climb a hill or a stair, heart rate variability, awesome. Even if I'm doing stuff that I shouldn't be, like staying up too late, or even in the past when I don't drink anymore, but if I'd have some alcohol, that definitely kills my heart rate variability. But even if I was doing things I shouldn't be doing, if I was living in my happy place and I was staying active, but it goes down if I do too heavy of a metabolic workout. I don't have a great adrenal system. So I did a pretty hefty kettlebell workout on Tuesday with my coach, and mine's been in the toilet, low 20 cents. So help me make some sense of that. And so the audience can learn.
Well, so heart rate variability, people hear heart rate and they go, "Oh, it's your heart rate." It's like, no, it's heart rate variability. It's literally the difference between intervals of heartbeats, right? How much time is there between heartbeats? I like to explain it in a different way, in something called respiratory sinus arrhythmia, which measures the same thing. But basically, if I was to take my pulse on my wrist right now and I take a slow, deep breath in, I would feel my pulse quicken a little bit. And if I take a slow breath out, I would feel the pulse go slower, right? And the difference between the fastest it gets when I take a breath in and the slowest it gets when I take a breath out is your respiratory sinus arrhythmia, which is a measure of balance in the autonomic nervous system, your stress response, the same as heart rate variability. And that measures your ability to adapt to stress. How able are you to encounter a stress and recover from it? And so we want a higher heart rate variability. We want more variability because that means we can go back and forth between two extreme states, right? We can adapt to things. And I kind of define health as the ability to adapt to certain situations. But yeah, that's heart rate variability. And so it's the best measure of balance in our stress response that we know of. And so to me, there's no mistake that it's measured through the heart, because the heart is this organ that we attribute, or that we associate with our emotional state. That's why we say, "I love you with all my heart," or "we gave it all our heart," or something like that. There's no mistake that this organ, it's like, I feel like it's like our sixth sense, our emotional sense, right? And it's actually communicating how we feel emotionally to our brain, because there's more signals being sent from the heart to the brain than brain to the heart. We're finding that with most organs, I think. But our emotional state is heavily connected to the health of our heart, because then, based on how our heart is feeling, our brain sends signals back down to it. How stressed, how fast do we beat? How do we regulate these things? These autonomic type things that like the heartbeat and stuff like that. So when I talked about like those metabolic heart attacks, the final piece of it was that surge in adrenaline, that surge in stress response. And that can happen improperly with an imbalance in our autonomic nervous system, with a low heart rate variability, right? And so there's actually studies that show in lots of heart attacks that the heart rate variability is dropping significantly the hour before the heart attack happens, like on people where they're already monitoring them in the hospital. And so, which is pretty fascinating. But when we look at heart rate variability, they say it should be anywhere from 20 to 100 is normal, which is a very wide range. And so lots of times, just like with any kind of number, people want to say, well, mine's higher than yours, ha ha ha, whatever, but it's really, you want to get your baseline. So you want to, so like you get your heart rate variability, you can't just really get like one reading. You want to measure it for 2-3 weeks and see what your baseline is, and then work to improve it from there. Because if you don't have a baseline, you don't know, based on what's going on in your life, where your heart rate variability is. Like you don't know how to gauge it to anything or compare it to anything if you don't have your baseline. And so mine's fairly low too. Mine hangs out like in the 30s. And
I feel better then.
yeah, but I know people that hangs out in the 80s.
Yeah,
like
me
that's
too.
their
I know
baseline.
people in the
Yeah.
hundreds who are like so stressed out and they eat like shit.
Mhm.
And I'm like, how is yours in the hundreds? That's
Yeah. And so like when I have like a client or somebody like you, like that takes care of themselves, it's really passionate about health, and they have this low heart rate variability, I always tell them two things. One, and I tell myself this too, because mine kind of floats down the low end too. One is the type of stress really matters, because we could say, oh, I'm really stressed, really busy, but they did this study looking at health outcomes and heart rate variability. And they studied all these people within this company, this big company. There's lots of employees, and the people who were kind of lower on the totem pole and didn't have job security, didn't have secure wages, didn't control their work schedule, those types of things. The stresses that made them feel either in unpredictable situations or out of control had a much bigger impact and detrimental effect on health than the people who also reported really high stress, but were higher in the company and had more control. It's all about control, which, so you can imagine what the past years did to people when all these things just made us feel out of control. It was insane. So those are the type of stresses you want to look for. It's not just adding in, like, because, you can add in meditation, you can add in nature exposure and all these things that have been shown to balance the autonomic nervous system. But we really want to eliminate the things that are creating it. And so when we think about what things can we eliminate, it's those stresses that make you feel like you're in unpredictable situations or out of control. Those are the most important ones to see if you can mitigate in some way. And then also add in those things that help balance the autonomic nervous system and create this. Because I say adding meditation and nature exposure and cold baths and all these different things is great. But if you're not addressing that cause, then you're just putting out fires without trying to catch the arsonist.
yeah.
And so that's important. The other thing is, and this is something I've recently come to realize, and I wrote about it in my book, but I don't think I quite realized how important it was, unresolved trauma. Reading this fast, I don't know if you're familiar with Peter Levine, but like his work is just blowing my mind, because I wrote about it a little in my book as far as the evolved mechanism of stress between reptiles and mammals. But it seems that our body is where trauma is stored. And we're so focused on the mind as far as our treatment. It's another way that Western medicine's just gotten it completely wrong. And so his technique is just, I think, a huge breakthrough. And so if people should explore that too, because they could be doing everything right, but if there's just unresolved past trauma that's literally changing their body's physiology and there's nothing their mind can do about it, then they're, again, trying to, put out the fires without catching the arsonist.
No, I completely agree. It's funny. I've had this long standing back pain, and I got to a point last year where I had tried everything I know, and I know I have access to a lot of cool stuff, and I was doing everything and I just felt like it was off. And then I realized all the old past traumas I had compartmentalized as I built my career. I just shove them in a box, like a theoretical box. Sometimes it's like those IKEA bookcases that you can put records in that are those squares. And you can buy the ones that are longer or taller, and you can turn them sideways and you can just add more.
Exactly.
That was my trauma response.
Yeah.
Those IKEA bookcases. And they have the glass doors for them and the solid doors. So sometimes they'd be behind a door, they'd be locked. Sometimes they'd be behind a glass door. And I finally realized in this last year, I'm like, I have to deal with all this shit. This is, and since I have been, my back has been feeling so much better, and for lots of reasons, but that it really was profound. And actually working on that energetic kind of, I don't know what else to call her. She's kind of a shaman psychic, this woman I work with, and just working on that realm has been so tremendously helpful. And it's funny because what she keeps coming back and telling me that my higher self is saying is to stop worrying about control. I don't have control. Everything is in perfect order. Everything is as it should be. Every role everyone's playing is the role they're supposed to be playing, and everything is in divine order, and you can't control it. And so I'm learning to not have control. And it's a big step for me, but man, is it liberating when something just came up with my daughter recently, and my husband was freaking out about it. And I was like, we have no control over this. We have no control over this matter. So we can
Yeah.
flow with it and make the best out of it as we can, or we can sit here and gripe about it, And so these are lessons we learn, I think, as we age, unfortunately. I think by the time we figure this out is when we're old enough to have a heart attack.
Well, it's a really, really important point you just made, because I talked about how, like, when you look into your life and what stresses are stressing you out, those ones that make you feel like you're out of control in unpredictable situations, those are the ones you want to get rid of. But if you can't get rid of those, what's really important is maybe changing your perspective of those stresses, because we tend to, we're the only species on the planet that thinks our way into stress responses. Even if nothing stressful is actually happening to us, we can think our way into that stress response. So it's an important point that you bring up. Sometimes you have to change your perspective of a stress to totally conquer it.
Yeah, that's been a huge shift for me as I age. I wish I'd learned all these things in my 20s and 30s. And I'm so impressed by people. I know you're younger than me. I won't ask how old you are, but I meet people who are, I refer to them now as young people because I'm that old. And I'm so impressed with the insight that you all have. And even my daughter at 22, just some of the profound things that come out of her young mouth I'm so impressed that people are making these things a priority in their younger years versus me. I was part of that generation of like, you don't need any sleep, work hard, tackle it all, and, push on. And that's just not we need some grit and resilience for sure, but we need to learn to, basically, I think what you're saying at the end of this is we should all be meditating more in our saunas.
Pretty much. That'd be a start. Yeah.
Oh my gosh. Well, this has been so much fun and truly, truly mind-blowing. Thank you for your insight and what you just taught me, because I normally come on and I love my podcast because it gives me a chance to learn, but this one's really been like, you just helped me sort out a lot of puzzle pieces.
Well, good.
Where can the audience find you and your book and all of your wonderful resources?
Yeah, my website is resourceyourhealth.com. People can find like my blog, and my health coaching is on there. My books are on there as well. My books are also on Amazon and through the publisher. And if you don't want to go to Amazon, there's other places you can get it too. And then I am on social media a little bit reluctantly, but I'm on social media, Instagram and Facebook and Twitter. Just Dr. Stephen Hussey, Dr. Stephen Hussey. People can find me and contact me there.
Okay, cool. We'll put all the links in the show notes and we'll get everybody, and we'll put that book you mentioned in by Pollock in there. What is that? Cells, Gels, and
The Engines of Life.
That sounds amazing. Can I ask you one question before we leave? Have you seen Donnie Darko?
I have. It's been a long time though.
Go watch it after what you just told me. That's all I was thinking about. Everybody listening, go watch Donnie Darko. I'm not going to give it away, but
yeah, it's definitely was. I saw it before I knew all these things I've been talking about. So yeah.
And if you can't put it together, send me a message and I'll explain why I think this. But that fourth phase water thing, I don't know. It made my little tingly brain go off. So it was such a pleasure to have you on. I'm so glad to finally connect. I hope you'll come back and give us some more insight in the near future. And thanks for being on the Dr. Tyna Show.
Thanks for having me.